we try to determine as much as possible the source of the pain and direct our treatment toward that source. For example, if you have low back pain, if it's short-term low back pain, it may just be a muscle strain. You may have developed a myofascial syndrome, a problem with the muscles and connective tissue, and that may respond to trigger point injections, bracing, ice, heat, topical treatment. If it's a deeper structure, there are different structures in the lumbar spine that can cause pain: the facet joints, the sacroiliac joint, the disc itself. It's important to identify which of those is causing the problem, causing the pain, and address your treatment, tailor your treatment toward that pain generator, as opposed to just giving the patient a narcotic or non-narcotic pain medication and sort of shotgunning it. In that case, basically what you're doing is dulling the brain to the sensation, the painful sensations that are being sent to it. What we try to do is identify the actual structure that is causing the pain and treat that. At the same time, of course, these are human beings. They're not just a laboratory animal. They're not a mechanical device. They're a human being. And when you have pain for a long term, it doesn't have to be that long, for 3 months or longer, you begin to have psychosocial issues attached to it. You know, you've lost function. You can't. Your job is at risk. You can't do things with your spouse that your spouse wants you to do with them. All these things are tied together. There's a significant amount of depression that is associated with chronic pain. And of course, when one becomes more depressed, one becomes less active. When one becomes less active, one becomes deconditioned. And therefore, one decides to go do something, you re-injure yourself, and the pain is worse. So we try to intervene not just with injections or not just toward the structure. Although we try to identify the structure, we also do not ignore the fact that there's a larger problem going on here. The patient may need some support, some psychological support. That may involve anything such as group therapy, church support. There are group therapies that we avail ourselves of at the facilities here, at the hospitals here, that do things like positive imagery, such as biofeedback techniques. And all of this needs to be brought to bear on chronic pain in order to have a successful outcome. Successful outcome oftentimes does not mean the pain is completely gone and you're restored to where you were when you were 20 years old, but it allows the patient to be in a position where they can manage their pain, continue with their life, return as much as possible to the life they had before and the activities that they enjoyed before.